Uh, Dr. Michael Ryan with Missouri Vein Care. I'm talking about some tips that can help with getting a better night's sleep. And you may wonder, why is a vein specialist talking about sleep? Well, it's because I would say probably three-quarters of our patients have a sleep disturbance. Usually it's related to their veins, but it obviously can be due to other causes. So we see people with sleep problems pretty much every day of the week. And so I have learned to query people about some of their habits, make some recommendations to improve their sleep function. Um, the One of the things about sleep is that, from my perspective as a vein care specialist, is what's the problem? Is that you can't fall asleep, you can't stay asleep, or you sleep and you wake up and you don't feel rested. Those are three separate patterns that indicate different causes. Um, I'm not going to go into the details of how to sort out each one, but that's one way to think about what your sleep problem is. And as you look at your own sleep habits, that's the first step, is to answer that question. Is it before you fall asleep? Is it or trouble sleeping? Is it trouble staying asleep? Is it trouble just feeling rested in the morning? So some tips. Well, first of all, I when I'm seeing patients, we're screening them for vein reflux. Vein reflux is a very common cause of sleep disturbances, and the way it works is stagnant blood in your legs allows inflammation to build up. The inflammation then interferes with your sleep center in your brain. The inflammation also triggers a lot of leg symptoms, that like cramps and restless legs, that prevent people from having a restful sleep. So those are common reasons that people have disturbed sleep, and 75% of people with a vein condition have disturbed sleep, or poor quality sleep that improves after treatment. Another very common problem is sleep apnea, and for reasons that aren't completely clear, the the incidence of sleep apnea is increasing in the society, and it doesn't necessarily relate to the amount your body weight. That's commonly felt to be the biggest risk, is your weight, but it seems that other factors may be leading people with normal body weight to have sleep apnea. Sleep apnea is something that you can't diagnose yourself. You can't say, "Oh, I don't have it," because you're asleep when that diagnosis is made, and it's something that has to be made by someone who observes you, or you can get a home oxygen test from your doctor to measure your oxygen level at night. And in some cases, you have to go to the hospital for a sleep study, which is the most detailed type of study, but also the least convenient for obvious reasons. So those are the things I talk about up front, and then I talk to patients about their other habits. Too much alcohol in the evening will disrupt your sleep, and alcohol initially is a depressant, so you'll want to sleep, but then as it wears off, and it wears off over a period of several hours, there is a rebound stimulation of your brain, and people will wake up at whatever hour, midnight, 1, 2 o'clock, and they're wondering, why am I waking up? They're waking up because the alcohol has worn off, and now their brain is awake. And so alcohol too close to dinner time, or too much in the evening, or too close to bedtime, or too much in the evening, is going to do that. So the best test is to skip alcohol for a couple of nights and see how your sleep patterns improve. Caffeine is another common problem, that people don't realize how long it takes caffeine to get out of your body, and the body processes caffeine in a very standard way, which is uh, based upon how much is present in your body. It will clear out half of it over a period of 6 hours. So if you drink 4 cups in the morning, 6 hours later you have the equivalent of 2 cups of caffeine in your body, and 6 hours later, 12 hours later, you have the equivalent of 1 cup of coffee in your body. And then 6 hours later, you have the equivalent of half a cup of caffeine, or coffee in your body. So you have to be very careful about how much uh, coffee, caffeine, tea that you bring into your body, because the body can't clear it out right away. So caffeine is another big challenge for people, and that's hidden in sodas and teas and other energy drinks. Other habits that are really helpful for people is to get into a regular routine in the evening, which it's going to be determined by the individual, and you need to kind of do your own research to find out what's going to work for you. But some things that do help with sleep health is taking a warm bath or a hot tub or a couple hours, 2 hours or so before you're going to go to sleep, because your body temperature will go up with those activities. And then as your body temperature cools down, the cooling down is the signal inside your brain actually that indicates it's time to go to sleep. And so actually, as your body is cooling down, that is going to help you want to wind down and go to sleep. Um, other things that are really important in the evening, you can do some stretching or yoga. You don't want to do strenuous exercise, either cardio or weightlifting, too close to bedtime, because it will be a stimulant to your entire body. You want to give yourself at least 2 hours or so before sleep. The other big no-no is screen exposure. The screen exposure at night has a direct stimulus in the brain to keep you awake. And so that's hardware. It's really hardwired into us, because it's the signal that wakes us up in the morning and resets our internal clock, and we're really messing with it by using our screens late in the evening. You may want to try something different. May want to listen to an audiobook or read a book in the evening to hear something, a story, or read a story, as opposed to watching screen time. The other simple habits is that the ingestion at dinner time of a large amount of protein will stimulate your body and will raise your body temperature. So a big protein meal in the evening is something that can really interfere with the quality of sleep. So eat like a king for breakfast, a prince for lunch, and a pauper for dinner. There's some truth to that. So eating a light meal in the evening with relatively low amount of protein, if you are struggling with your sleep health, that's something that you may want to try. Um, Other things, there are certain foods like those laden with monosodium glutamate, or MSG. And MSG itself is a excitatory product. It's a product that will actually excite the nervous system and provide a stimulus to be awake. And for some people, it can do other things like trigger migraines and things like that. So if you're eating Chinese food or other foods, because MSG is in so many different foods, especially restaurant foods, and you find that you can't sleep at night, it could be the MSG. Oh, yeah. And so the other common things that happen with people, ones that have trouble falling asleep, is that their mind can't slow down. And part of the problem with the mind that can't slow down is you're worried about something. You can't act on it. You're paralyzed and trapped in your bed, and you really want to act on the whatever it is that is concerning you. One simple thing to do is to have a habit before you get to bed of having a journal where you can call it a planning journal, you can call it a worry journal, and you write down the things that are on your mind at that moment, and you have to attach a real actionable plan that you can do in the morning when you wake up. So it's a form of packaging it up into a box, closing the box, and putting it away, so that you can go to sleep and know that you have a plan. You're going to hit it in the morning and take care of it. Well, another practice is for people that are filled with anxiety and worry and their mind is looping, is the practice of gratitude. Gratitude is something that people know what that is. They've been grateful at different times in their life, but it's something that people don't realize that they can actually control, and they can actually develop. And it's based upon the idea that when people experience an emotion, they can only experience usually one emotion at a time. They can't experience, anger and love at the same time, or hate uh, and love. It's just one. It's one emotion at a time. And gratitude, if you think about things you're grateful for, all the other negative emotions like anxiety or fear, or they recede, and they can't exist in your consciousness. So practicing gratitude is one of the healthiest and easiest ways to control your mental space in a way that provides you, positive mental health. So that is something that is very easy to do, and that will allow the other uh, fears and worries to fade away. So, Dr. Michael Ryan discussing ways to help with sleep hygiene, um, and we see sleep problems pretty much every day of the week.